right. So today I'll be presenting findings from our national analysis titled Overdose Mortality in Canada, Long-Term Trends, Age and Sex Disparities, and Regional Variations. Overdose has become a leading cause of death and disability among middle-aged Canadians, with over 47 deaths since 2016. While fentanyl has accelerated recent trends, this crisis actually spans multiple decades. It's been shaped by systemic drivers such as prescribing practices, increasing potency of the drug supply, and the COVID pandemic. The crisis isn't a result of one single event. In Canada, pharmaceutical opioid prescribing in the 1990s and 2000 created widespread dispersion and diversion. Around 2014, fentanyl and other synthetic opioids that entered into the market further drove the deaths even more. And recently, the COVID-19 pandemic disrupted harm reduction services and treatment services, further compounding deaths in Canada. So to understand how these forces have shaped mortality over time, we examine national and provincial trends in Canada spanning 50 years. So our study objective was to quantify long-term trends in overdose mortality in Canada from 1974 to 2023, identifying when and where the most pronounced changes occurred. We also examined differences by sex, age group, and province to understand variation across populations and regions. All right, so let's start with the data sources that we used in our analysis. We drew on national mortality data from Canadian Vital Statistics Deaths database. Drug poisoning deaths were identified using the ICD-8, 9, and 10 codes, harmonized across coding eras to ensure consistency over time. Annual age and sex-specific population estimates were gathered from Statistics Canada, allowing us to calculate crude mortality rates and track trends over 5 decades. So next in our analysis, we calculated crude mortality rate per 100,000 population. We defined overdose deaths broadly, including accidental deaths, undetermined intent, and drug-related adverse effects of therapeutic use. This inclusive definition was important because in mortality data, it's often unclear and also difficult to separate accidental deaths from self-harm and medication-related death. We use crude rates rather than age-standardized ones to preserve internal comparability over time. Crude rates also capture both demographic shifts and actual mortality risk within true population-level burden. So finally, we applied segmented regression or joint point regression to detect inflection points, identifying when and how sharply these changes have occurred in national overdose trend line. To test the robustness of our findings, we conducted 3 sensitivity analyses, where we modeled the absolute number of deaths to make sure that the observed changes weren't simply due to population effect or denominator effect. Secondly, we recalculated these trends using age-standardized mortality rates, standardized to the 2011 Canadian population. This helped assess whether demographic shifts influenced our results. And finally, we repeated the analysis focusing on accidental poisoning deaths only to see whether excluding suicides and undetermined intent altered the overall pattern. So coming to results, here we see nationally, crude overdose mortality in Canada increased tenfold from 1974 to 2023. So this trend was relatively stable until 1991. Then it rose more steeply at about 5% annually through 2011. And after 2012, mortality accelerated further, rising 11.5% annually through 2023. So when we stratified this by sex, we saw that men consistently had higher overdose mortality across all years. However, However, the surge began after 2012, with an average annual increase of about 13% through 2023. For women, the acceleration began a few years later, around 2015, rising by about 9% per year. So while men remain more affected compared to females, mortality among females has been rising in the recent years. Here we show 8 specific trends in overdose mortality. Overdose mortality increased across all age groups, but the timing and the pace of the change were quite different. For those aged under 25, rates were flat until the late 1990s, and then spiked briefly between 2014 and 2017, with growth exceeding 30% annually before stabilizing or flattening out. Adults aged 25 to 44 showed the most sustained and steepest increases after 2012, with about 14% per year growth. Among 45 to 64-year-olds, mortality initially declined, but then it was steadily climbing roughly 12% per year after 2014. And for adults aged over 65, the rise was more recent and abrupt, nearly 18% annual growth since 2020. We also observed substantial regional variation in overdose mortality across Canada. So in British Columbia and Alberta, they recorded the highest rates with steep increases beginning around 2010. Saskatchewan showed the most rapid recent acceleration, while Ontario experienced a distinct surge after 2014, while Quebec followed a more gradual upward trajectory. And the patterns in the Atlantic provinces were heterogeneous, some showing sharp increases, followed by stabilization or decline. Overall, these findings point to strong regional disparities in overdose mortality, reflecting differences in drug supply, policy responses, and access to harm reduction services across provinces in Canada. To summarize, overdose mortality in Canada rose dramatically over the past 5 decades, with 2 clear accelerations, one in 1990s and then 2012. The rise occurred earlier and more steeply among men, while women experienced a later and a sustained increase. Mortality has shifted towards working age and older adults in Canada, with strong regional heterogeneity and a distinct west to east gradient. So to contextualize our findings with what's happening in the US, overdose mortality has risen exponentially since the 1970s, increasing by about 9% per year across 4 decades, as shown by Jalal and colleagues, published in Science 2018. Canada's pattern was more delayed and showed a segmented pattern with a long period of relative stability followed by 2 sharp accelerations. In the most recent years, that is from 2012 to 2023, mortality in Canada increased by about 12% per year, outpacing the US during the comparable years. This suggests that while the Canada's onset was later, it is now on a parallel and increasingly alarming trajectory. These shifts in mortality reflect the intersection of market forces and structural inequities. The first acceleration that we saw in the 1990s aligns with widespread opioid prescribing in Canada and the emergence of fentanyl and synthetic opioids that came into the market in 2013. So these shifts were amplified by housing unaffordability, limited healthcare access, and a weakening social safety net, all operating within a broader neoliberal policy context that shaped the risk environment. The COVID-19 pandemic further intensified these vulnerabilities, not as a new driver, but as a stress test revealing how fragile this system already was. So this study has notable strengths. It is the first study to examine 50 years of overdose mortality nationally. We used segmented regression to identify inflection points, applied multiple sensitivity analysis, and stratified results by sex, age group, and province. Limitations include potential misclassifications due to ICD coding changes, broader outcome definition that is required for comparability, provincial variation in reporting deaths, and the fact that our data end in 2023, which does not capture the recent dynamics. So yeah, in conclusion, the 50-year analysis shows that overdose mortality in Canada has risen tenfold, driven by two structural transitions, that is prescribing era and fentanyl era. These changes have dispersed inequities by sex, age, and province. And the key takeaway is that reactive measures aren't enough. We need sustained investment in harm reduction, evidence-based treatment, including opioid agonist therapy and integrated mental health support, as well as broader social policies and affordable housing to slow this trajectory. So I'm happy to share that this work was published last week in IJDP, and it lays the foundation for my continued thesis work exploring mortality in people who inject drugs. Thank you.